Now, with that said, there is a classic externality that arises when you think about an infection. We call it's an infection externality, which is people who are infected with the virus simply don't internalize the effect of their consumption and work decisions on the spread of the virus. And I remember speaking to a journalist early on, and he said, "Oh, it's like pollution." And I said, "That's exactly right. As economists, we understand that externality, and most of us are very comfortable with the idea of taxing such an externality." So that leads to the question, okay, well, which policies should the government pursue to deal with that externality? Well, you can break up the classes of policies we've thought of, and I'll give you obvious extensions that we're working on now. The first I would say is simple containment, and we model that in a variety of ways, but those are policies that reduce consumption and hours worked in ways that don't condition on people's health status or demographic status or things of that nature. So they're relatively brute force. And in our model, you'll see they're effective, but they're certainly very costly. There's another class of policies, which I'll call smart containment, which does treat people differently according to their health status. And the way we analyze it, you'll see it's almost aspirational in the sense that it requires to implement a great deal of technology, which quite frankly, we don't have. So I really think of it as saying, look, if you had that technology, it's dramatically better than simple containment because you could basically manage to deal with the epidemic without a severe recession and without a large number of deaths. So it really says the returns to developing that technology are extremely large. We're currently working on an extension of the model that I'll talk about today, which allows for type 1 and type 2 errors, both in testing for infections and for people that are recovered. If there's time, we can come back to that at the end. Look, we're going to use a pretty simple model because we started off on this, and that means there's a lot of important epidemic policy related issues that we're simply not ready to talk about yet. So, for example, um, just plain humanitarian issues like many people are losing their jobs, they're constrained in their ability to borrow, and for lots of reasons, we'd want to help them. The liquidity issues, which of course the Federal Reserve has been quite terrific on, and hopefully the ECB as well. But I want to stress another thing that a CEO of a major bank and I were talking about, and he said the way he thought about the virus and policy was, yes, of course, there's the short run effects, but there's a bridge. We need to somehow find a bridge to the after. And the problem is we don't quite know how long the bridge has to be, but there's an awful lot of human capital and firm capital that we don't want destroyed, and we need to think of policies to deal with that. That's something I think is easy. We all agree on, but of course, God is in the details, and that's not what we're going to talk about today.